Hi, I'm Chanel, one of the journalists at Manx Radio. Welcome to the latest edition of Manx Radio Newscast.
Yes, I'm specifically interested, certainly at the moment, with regards to the screening programs that have been in place for a large number of years for residents on the island, but more specifically was with regards to breast cancer and the cervical cancer screening changes and the possibility of decreasing the frequency of the routine screening. I've been inundated with concerns that and the major issues of people, it unnerves them, but also the many people that have contacted me, and I was a patient myself. I was picked up on 2 years, so that my actual treatment, and it's what everybody that's contacted me is saying, is cheaper if you picked up early. So if you leave people another year, the treatment and costs are going to be significantly higher. And I think that is a proven statistic.
Have you tried to air some of your concerns to the DHSC minister?
I have spoken to the minister. I have informed her that I don't believe that she can put this into the mandate, as it was a resolution that went through Tynwald in 1997. It was funded through Tynwald in 1997, and it's been there. It was a choice by Tynwald to do a service for the people on the Isle of Man of 2 years breast cancer screening, particularly from the age of 50. So I don't believe that it can just come into a mandate and that's accepted. I think with a Tynwald resolution, it's the will of Tynwald, and I believe that should come back to Tynwald specifically as an item to be debated.
Now, you said that you mentioned this to her. Would you be able to share any of the feedback that you had gotten from your side?
I certainly haven't had anything specific yet. She was very keen to go and look at this. I've given her I've spoke to her about the Hansard of Tynwald, which I have, and it certainly was. I don't think the minister was aware of it, but she was certainly going away to look at this and ensure that it had been taken into consideration before it going into the mandate. But obviously, I haven't had that feedback yet.
Now, I understand, I remember from a few previous sittings, you were one of the MHKs asking to see the mandate and waiting for this document to drop so you could view it. Did you have an idea that things like this were going to be proposed? I've raised it a number of times with the previous minister, because the previous mandate, I've watched it carefully. We've had certain briefings with regards to the efficiencies, and we've got two experts in currently making efficiency changes in the DHSC, and there was a couple of things stated to me that did raise my concerns, and obviously before the mandate was actually published, I managed to put a question in for the House of Keys last week because the alarm bells were ringing at that point. Now, how vital is having these screenings? How vital is this service?
It's vital and crucial to diagnosing, and particularly women. These are both women's services if you think about cervical and breast, but men can get breast cancer as well. It's critical in getting an early diagnosis, faster treatment, and people on the road to recovery and staying as healthy citizens in our society, able to continue to work. If you end up having to need further treatment, radiotherapy, chemotherapy, or even more radical, you're not actually being given the best opportunity of life. Screening is proven throughout the world. The Isle of Man, and I know it gets stated it's gold standard. Well, let's be gold standard in the Isle of Man. We're pumping millions of pounds into our health service. And if this is one service that can save lives, save them, and reduce the costs of expensive treatments by doing it early, we should be doing it. Most of the world are doing 2 years. It's only the UK and I can't remember, it's one of the places now. It's only the UK that have done it for 3 years. So I'm not prepared to allow the Isle of Man. We're an independent island. We have an independent health service. We do not have to follow UK practices on everything. And this is one that I will fight tooth and nail on.
What's your fears around this, after reading the mandate? What's your fears going forward if this is pushed? My fears going forward is we're going to have a lot more people with not good outcomes, and the whole point. And certainly, I believe the minister and possibly the chief minister said it. Nothing will impact the outcomes for patients. This is an impact that could affect the outcomes for patients. As I've said, I've been a breast cancer patient myself. I was picked up early in 2 years. However, it wasn't early enough, but I was picked up at 2 years. If, like me and many other ladies that I've spoken to, we'd have gone to 3 years, the outcomes would have been different.
And I think my last question is, have you spoken to any of the cancer associations on the island, or have any of them reached out to you since your post?
They certainly have, yes. Obviously, breast cancer, the two breast cancer charities, actually the main ones, have. And obviously, I'm communicating with them closely. We're all of the same view that this is cost saving, but it's not going to save lives or give better outcomes for patients.
Thank you for making it to the end of the Manx Radio Newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.